This is UNAIDS.
Antiretroviral therapy has been one of the extraordinary successes recently. We've gone from having virtually nobody taking treatment to having 10 million people on antiretroviral therapy by the end of 2012. And that's keeping people alive, keeping them strong, preventing ongoing infection, and keeping people in work. WHO is responsible for producing guidelines, and they've been doing this every few years, and this is the latest in a series of guidelines that recommend to countries, particularly resource-limited countries, how best to use antiretroviral therapy. So the new guidelines have raised the threshold, so they allow treatment to be started earlier in the course of HIV. That increases the number of people who are now eligible for antiretroviral therapy from around 15 million to around 26 million people who now need to be treated. In addition, the guidelines have made life simpler. Previously, people had multiple different choices for what drugs they should be taking when they started treatment. It's now becoming clear that a single tablet taken once a day is the preferred regimen for most people starting antiretroviral therapy. The guidelines also simplify the recommendations for children, so that children under the age of 5 years who are HIV infected should now all start antiretroviral therapy. That's a very important question. Some countries have been making good progress, and under the previous guidelines have already managed to reach a lot of the people who were eligible for treatment. For those countries, these guidelines provide the opportunity to scale up treatment even further. Other countries are still struggling with the old guidelines and are not managing to get as many people on treatment as they should. For those countries, these guidelines should act as a catalyst to make them examine the bottlenecks as to why they're not getting people on treatment and explore the reasons for that and do something about it. It's not right that in 2013 we should have people dying of HIV. Antiretrovirals prevent that, and countries need to put treatment programs in place to stop people dying from HIV.